In this video, I'm going to talk about insulin resistance and how you need to reverse this if you want to be metabolically healthy and lose weight. Hi, I'm Dr. Midgen Brown, otherwise known as Dr. Midge on TikTok. Did you know that 88% of Americans are metabolically unhealthy? You've heard of metabolic syndrome or syndrome X, a constellation of symptoms which include increased waist circumference, elevated glucose levels, elevated blood pressure, increased triglycerides, and low HDL cholesterol. Well, 88% of Americans have at least one of these issues. Metabolic syndrome has a more accurate name, and it's called insulin resistance. It's a better way to describe metabolic health as it describes the root cause of what is going on. Insulin resistance is the impaired biological response to insulin stimulation. One of the main causes is chronically elevated insulin levels or hyperinsulinemia. Just like when you hear the same loud music in the background, you will eventually tune it out. That's what our body does with chronically elevated levels of insulin. The most famous role for insulin is its role in sugar metabolism, and when someone has insulin resistance, this can eventually lead to type 2 diabetes. What many people don't know is that insulin affects every cell in our body and has many different functions. And therefore, any problems with insulin will lead to a big list of symptoms and diseases. Some of the symptoms of insulin resistance include low energy, brain fog, difficulty losing weight, abdominal fat, mental health issues such as depression and anxiety, skin tags or dark discoloration around the neck or in your folds. You may also have irregular periods or PCOS in women or erectile dysfunction in men. Other symptoms of insulin resistance include feeling hungry all the time and sugar cravings, and feeling tired right after you eat. This is a great slide by Dr. Benjamin Bigman, a world-renowned expert on metabolic health and insulin resistance. Insulin resistance is the root cause of obesity, diabetes, cancer, heart disease and hypertension, fatty liver disease, neurological diseases such as migraines and dementia, and infertility issues with erectile dysfunction and low testosterone in men and PCOS in women. Insulin resistance is the biggest epidemic in the world, and most people don't know about it. It affects more than half the population of the US, China, the Middle East, Mexico, India, and a third of the population of Canada and the UK, but this is probably a very gross underestimation. Unfortunately, in medicine, we don't focus on insulin and we focus primarily on glucose. Type 2 diabetes is insulin resistance that has gone on for many years, up to 10 to 15 years, where our body needs to make more and more insulin to deal with the glucose in our body from our diet. Eventually, the body can't keep up with the insulin needs and our glucose stays elevated and we are diagnosed with diabetes. But before the diagnosis of diabetes, our insulin levels are becoming more and more elevated and we are becoming more and more insulin resistant. As mentioned, since insulin affects every cell in our body and has many different functions, this hyperinsulinemia and insulin resistance will cause many problems with our health. The other issue with insulin resistance is that some cells in our body are insulin resistant, but some cells remain highly sensitive to it. The cells that remain sensitive to insulin are now bombarded with too much. One example is the cells of our ovaries, and hence the connections between insulin resistance, hyperinsulinemia, and infertility. PCOS, for example, is a disease of too much insulin. It's insulin resistance of the ovaries. How can you tell if you have insulin resistance? If you answer yes to one of the following questions, you most likely have insulin resistance. If you answer yes to two of the questions, you most certainly have insulin resistance. Do you have abdominal obesity? Do you have high blood pressure? Do you have a family history of heart disease? Do you have elevated triglyceride levels? Do you retain water easily? Do you have dark patches around your neck or skin folds or skin tags? Do you have a family history of insulin resistance or type 2 diabetes? Do you have polycystic ovarian syndrome, PCOS, in women or erectile dysfunction in men? In order to improve our overall health, our metabolic health, we need to reverse insulin resistance. There are other causes that I won't go into much detail here, including stress and decreasing inflammation, but hyperinsulinemia, or chronically elevated levels of insulin, is the main driving force behind insulin resistance, and lucky for us, it's the one thing that we can do something about. One of the causes of our chronically elevated insulin levels is our current food environment. With our standard North American diet, we are eating 3 meals a day, breakfast, lunch, and dinner, and snacks in between, so most of us are eating 5 to 6 meals a day. In blue is our glucose every time we eat. You notice that it's going up and down. In purple is the insulin. It's released when we have a meal, especially a carbohydrate-rich meal. As well, when insulin is elevated and you have just eaten, it drives your blood sugar low, which then makes you feel like eating again. So this is the result: chronically elevated levels of insulin. In addition to eating 5 to 6 times a day, the type of food we eat contributes to this. Most of our diets are highly processed and devoid of fiber and nutrients. This will increase the insulin response of the foods we do eat. One of the simplest ways to decrease your chronically elevated levels of insulin and to improve insulin resistance is to intermittent fast. As well, when you do eat, you want to minimize the insulin impact of the foods you eat by focusing on protein, fats, and increasing fiber. Now, I've said that the above strategies for decreasing insulin resistance are simple, but it's not always easy. This is where the Feel Great system comes in. It's a helpful tool to help you intermittent fast and to get enough fiber to decrease the glycemic and insulin response of the foods you eat.